Dopamine medication. APAC name equal 4,2-aminorthalbin and minus 12-DL synonyms equal 2,34-dihydroxyphenylethylamine, 34-dihydroxyphenethylamine, 3-hydroxytyramine, DAW, Intropin, Revivan, Oxytyramine, Prolactin inhibiting factor, Prolactin inhibiting hormone. Trade name equal Intropin, Dopastat, Revivan, others drugs, COMT equal pregnancy, US equal Celsius legal or equal legal, CA equal legal, UK equal legal, US equal license, US equal dopamine legal, status equal RX, only routes of administration equal intravenous injection. Source tissues equal Substantia, nigra, ventral, tegmental area, many others target tissues equal system-wide receptors equal DA agonists equal direct, apomorphine, bromocriptine indirect, cocaine, amphetamine antagonists equal neuroleptics, metoclopramide, domperidone. Bioavailability equal protein bound equal metabolism equal MAO, COMT, ALDH, MAO-A, MAO-B, COMT elimination, half-life equal excretion equal kidney. UNII equal UNII equal VCD58 NZ to STD and CH, a ref equal STD and CH, V equal 1 S/A, tell than N not worse last 9 minus 4 minus 3 minus 6 minus 1 minus 2 minus 7 to 8 11 5 minus 6 slash home minus 2510 minus 11 H 3 minus 49 H 2 STD and CH, a T ref equal STD and CH, a T equal VYFYYTLLBUKUHU-UHFFFAOYSA-N CAS number ref equal CAS number equal 51 minus 61 minus 6 CAS supplemental equal hydrochloride pop 10 equals 681 CH symbol ref equal CH symbol equal 15910 spider a D ref equal 10 spider a D equals 661 kick ref equal take equal D7870 drug bank ref equal drug bank equal DB 988 if all legend equal 940 CH EBI ref equal CH EBI equal 18243 smiles equal neck consisting ADC prefix equal pune ADC suffix equal CFR. Celsius equal ALDH equal 11, north equal 1, or equal 2, density equal 1.26, boiling point equal boiling notes equal decomposis, melting point equal 128, melting notes equal solubility equal. Dopamine, sold under the brand name Intropin among others, is a medication most commonly used in the treatment of very low blood pressure, a slow heart rate that is causing symptoms, and, if epinephrine is not available, cardiac arrest. In newborn babies, it continues to be the preferred treatment for very low blood pressure. In children, epinephrine or norepinephrine is generally preferred, while in adults norepinephrine is generally preferred for very low blood pressure. It is given intravenously or intraosseously as a continuous infusion. Effects typically begin within 5 minutes. Doses are then increased to effect. Common side effects include worsening kidney function, an irregular heartbeat, chest pain, vomiting, headache, or anxiety. If it enters into the soft tissue around the vein, local tissue death may occur. The medication phentolamine can be given to try to decrease this risk. It is unclear if dopamine is safe to use during pregnancy or breastfeeding. At low doses, dopamine mainly triggers dopamine receptors and beta-adrenergic receptors, while at high doses it works via alpha-adrenergic receptors. Dopamine was first synthesized in a laboratory in 1910 by George Borgia and James Ewens in England. It is on the World Health Organization's list of essential medicines. In human physiology, dopamine is a neurotransmitter as well as a hormone. Low blood pressure. In newborn babies, it continues to be the preferred treatment for very low blood pressure. In children, epinephrine or norepinephrine is generally preferred, while in adults, norepinephrine is generally preferred for very low blood pressure. In those with low blood volume or septic shock, this should be corrected with intravenous fluids before dopamine is considered. Kidney function. Low dosage dopamine has been routinely used for the treatment and prevention of acute kidney injury. However, since 1999, a number of reviews have concluded that doses at such low levels are not effective and may sometimes be harmful. Administration. Since the half-life of dopamine in plasma is short, approximately 1 minute in adults, 2 minutes in newborn babies, and up to 5 minutes in preterm babies, it is usually given as a continuous intravenous drip rather than a single injection. ALDH. A fluorinated form of L-dopa known as fluorodopa is available for use in positron emission tomography to assess the function of the nigrostriatal pathway. Contraindications. Dopamine should generally not be given to people who have a pheochromocytoma or uncorrected very fast heart rate. Side effects. The LD, or dose which is expected to prove lethal in 50% of the population, has been found to be 59 mg/kg mouse administered intravenously, 950 mg/kg mouse administered intraperitoneally, 163 mg/kg rat administered intraperitoneally, 79 mg/kg dog administered intravenously. Extravasation. If extravasation occurs, local tissue death may result. The medication phentolamine can be injected at the site to try to decrease the risk of tissue death. Mechanism of action. Its effects, depending on dosage, include an increase in sodium excretion by the kidneys, an increase in urine output, an increase in heart rate, and an increase in blood pressure. At low doses, it acts through the sympathetic nervous system to increase heart muscle contraction force and heart rate, thereby increasing cardiac output and blood pressure. Higher doses also cause vasoconstriction that further increases blood pressure. While some effects result from stimulation of dopamine receptors, the prominent cardiovascular effects result from dopamine acting at alpha, beta, and beta-2 adrenergic receptors.